So there's many different types of psoriasis. The number one, and of course most common, is what we call plaque psoriasis. So these are those sort of what you imagine with psoriasis. So, pink, sometimes red, very scaly, with what's called like a silvery looking scale. Most commonly, you're going to find it on the elbows, on the knees, back, chest. It can actually be anywhere. But plaque psoriasis is the most common presentation. So the second type of psoriasis that we see, fairly often, is called guttate psoriasis. And guttate actually means coin-shaped. So as you imagine, it's these sort of like annular, circular, coin-shaped psoriatic lesions all over the body. It can be anywhere. It's usually in response to some sort of internal respiratory infection, most commonly strep. A third type of psoriasis, which is not common, is pustular psoriasis. So literally these kind of white, painful pustules, almost nodules, that most commonly are going to occur on the palms and the soles of the feet, tips of the finger. These could be very tender, so definitely need to be treated very quickly. So a fourth type of psoriasis is called inverse psoriasis. And I know this has been showing up and flooding TikTok lately for whatever reason. Not as common as the other types, but it can be stubborn to treat. So where does it show up? So it shows up in the folds of the body, armpits, in the groin area, under the breast. And what's tricky about it is it often, because it's in like a moist fold of the body, it often doesn't show that scaly appearance that you're used to with psoriasis. So it's often, misdiagnosed as maybe like a eczema or, a ringworm, some type of fungal infection. So sometimes a lot of patients who have inverse psoriasis have been through a lot of doctors and dermatologists before they get the correct diagnosis. But that's what that one is. And the last type of psoriasis that we'll talk about today is erythrodermic psoriasis. Extremely rare, less than 2% of the population. And this is sort of this angry, like widespread body psoriasis that can be very hot, often is accompanied by fevers, chills, can go up in terms of manifestation during, hot periods or in hot temperatures. Again, this usually is going to require a systemic medication or oral medication to control, not just topical creams and stuff like that. But again, it's very rare.